Hello everyone, my name is Jonathan Andrade and I'm an amazing student at UCSG University. I'm going to talk about angio testing, Neprilysin inhibition and acute discompensated health fair. Let's begin with introduction. Introduction. Heart failure is a clinical syndrome caused by a stroke effect in a resulting in impairment of ventricular filling. The most common cause is a heart failure is reduced left ventricular myocardial function. However, dysfunction of the pericardium, myocardium, endocardium, heart valves, or the lung, or in a combination is also associated with a heart failure.
Your heart is a muscle that pumps blood around your body. The term heart failure can sound frightening, but it simply means that your heart can't pump blood as well as it should. Heart failure can be caused by a number of things: high pressure, problems with heart valves, or cardiomyopathy, a disease of the heart muscle. Joe has just been diagnosed with heart failure. Because his heart can't pump blood around his body as well as it should, it's causing symptoms in different parts of his body. When blood isn't flowing properly, it can lead to a build-up of fluid or congestion, a bit like a traffic jam. It builds up in Joe's lungs, leaving him breathless. Fluid can also build up elsewhere in Joe's body. He notices this as weight gain and swelling legs, lower back and abdomen. Just from fatigue, because his heart can't deliver enough oxygen-rich blood to his muscles. With your continued support, we're funding research to one day find a cure for heart failure. Right now, Joe uses medication to manage the symptoms and help him have a good quality of life. Joe has also made some lifestyle changes to help keep his heart healthy, such as quitting smoking, cutting down on alcohol and salt, staying active and keeping a healthy weight. Joe doesn't need any further treatments at the moment, but because heart failure can get worse over time, he may need them in the future. Some people are recommended to have a pacemaker or implantable cardioverter defibrillator, ICD, to help treat their heart failure. Joe spoke to his doctor has also recommended a cardiac rehabilitation program to help him get back to as full a life as possible. The program has improved Joe's energy and stamina and gave him the emotional support he needed when feeling low. This has helped Joe to continue enjoying life. For more information on living with heart failure, visit bhf.org.uk. BHF. Beat heart.
Let's continue to application in medicine. You might be experiencing signs or symptoms of heart failure. Seek emergency treatment if you experience any of the following symptoms: chest pain, fainting or severe weakness, rapid or irregular heartbeat associated with a shortness of breath, chest pain or fainting, sudden, severe shortness of breath and coughing out pink, foamy mucus. Although these symptoms may be due to heart failure, there are many other possible causes, including other life-threatening heart and lung conditions.
Hi, I'm Dr. Mamta Gandhi. I'm a kidney doctor currently practicing in beautiful Birmingham, Alabama. I've been a nephrologist for 5 years and truly enjoy working with patients who have need. In part one of our we want to focus on congestion and kidney disease. The interplay between the heart and the kidneys is one of a fine balance. While conditions is complicated in itself, when they occur to manage them simultaneously. In order to understand these two conditions, it's important to understand each individually. First, I'd like to address heart failure. Congestive heart failure is a chronic progressive medical condition that affects the proper functioning of the heart. Poor functioning of this, like fatigue, shortness of breath, and swelling of the legs or abdomen called edema. Conditions including heart disease such as blocked arteries, previous heart attacks, certain medications, high blood pressure, and even underlying chronic kidney disease. Now, let's understand kidneys and how kidney disease contributes in this interplay. The kidneys are responsible for a number of functions, including filtering of waste products from the blood and eliminating excess fluid from the body. Chronic kidney disease, or CKD, occurs when kidneys don't function properly due to various the filtering ability of the kidneys and decrease their overall functionality. When coupled with congestive heart failure, kidney disease can worsen, and vice versa is true. Edema and electrolyte abnormalities. Chronic kidney disease and congestive heart failure can sometimes become a complex, vicious circle that is often very difficult to treat. However, recent advances in early detection of both chronic kidney disease and congestive heart failure has in patients achieving improved outcomes and well-being. In managing, the nephrologist often works together with the cardiologist to provide patients with a good clinical plan. In the next section of this, see about treatment options for patients with cardiorenal syndrome.
Let's continue to pros and cons. Pros: greater reduction in the concentration of the native probe BDM, oxygen, sedation, hydromineral balance. Cons: the main adverse effect is the angioneurotic edema, tachycardia, hepatomegalia.
Hi, I'm Dr. Mamta Gandhi. The series on congestive heart failure and kidney disease. The following are some treatment options your team may implement to control both chronic kidney disease and congestive heart failure. My approach to manage these two chronic conditions of four main interventions. First, patient education. Second, dietary changes. Third, a weight-based diuretic regimen. And fourth, treatment of concurrent medical conditions. Let's start with patient education. Understanding the interplay of the heart and the kidney is I need my patients to be well educated about dosing based on daily weight monitoring. The second intervention is dietary changes. I request all patients to follow a salt diet. This is an important intervention. Diuretics or fluid pills, as well as high blood pressure medications, work better when a patient eats less salt. I also request my patients to be on a fluid restriction and decrease. This sets stage, which is weight-based diuretic management. Patients are started on diuretics or fluid pills to help remove excess fluid from the body from fluid accumulation. The fourth intervention continued management of comorbid conditions, appropriate management of underlying congestive heart failure, high blood pressure treatment, and diabetes management. In addition, I want to address the role of exercise in managing these two conditions. While sometimes it's difficult to do, even moderate weight loss and light exercise can be helpful. And chronic kidney disease sounds overwhelming. Careful monitoring and treatment in partnership help you experience a healthy lifestyle. This video only serves as an overview of treatment options. Comprehensive document and chronic kidney disease. You can download it at our website www.com.
And finally, the conclusion. Heart failure in death is a complete disease. It so far has been a major cause in morbidity and mortality in developing and developed countries. And standardized medical therapy has been successful in the early stage of heart failure. Hospitalization, the presence of the severe heart failure or the associated comorbidity condition, with implementation and an appropriate individualized multidisciplinary approach in a quality measure admissions.
Heart failure can be prevented if captured early. Early signs might be shortness of breath, fatigability with usual activities that you once could do very easily. Also, if you have a family history, you have to pay attention to it. It's one of the strongest indicators that you also could develop congestive heart failure. And it's completely preventable if we catch it or arrhythmia, high blood pressure, diabetes. This patient could have congestive heart failure in their future. And once I start thinking about that, then we start diagnosed in the physician's office. You have to see your physician. When you speak with your physician and they do their physical exam, that's when the aha moment happens and they think, this patient may have congestive heart failure. We do some simple tests in order to figure out, which is just an ultrasound of the heart, an X-ray, an EKG, which is a heart tracing, and some blood work. Those are the first steps to diagnosing congestive heart failure, and then that can lead to heart failure has many, many treatment options. That's why it's important to be diagnosed early, because the earlier you're treating you and the earlier you're going to feel better. We have medications that are guideline proved. Beta blockers, diuretics to help you breathe a little bit easier, and lifestyle changes that will greatly enhance your quality of life. That's not enough. We have very highly technical pacemakers that can help your heart pump better. And they're easily implanted with just 1 day in the hospital and very, very easy to live with. Advanced treatment options, which would include any clinical studies that we have available, would include cardiac transplantation. Many patients have lived well over 20 years. Pacemakers, preventive lifestyle management usually works for more than 90% of patients. Mass General Heart Center offers comprehensive care for the heart failure patient, from cardiac surgeons to latest technology. We work with your community doctor who you know and trust as part of the team. Understand and treat your condition the best way possible. We want you to live well.
Thank you for your attention. Please leave your like and comment below. Goodbye.